are very proud of this project. We've been working on it for almost 6 years. This is phase 2 of a project.
It started as a pilot with 3 countries. And we were one, Ghana was one, the Philippines, we had the Dominican Republic, and now it's swung to Uganda, and Uganda and Ghana are in the next phase. This is our second phase.
The Rotary USAID partnership is a unique private-public partnership which leverages the business skills and community leadership of Rotarian volunteers with the technical skills of the USAID to provide lasting changes in selected communities in Ghana. There are 3 components of the project. Component 1 deals with infrastructure, wash infrastructure. Component 2, advocacy and leadership. Then component 3, innovations. Under component 1, which is wash infrastructure delivered, we have water infrastructure and we have the sanitation infrastructure.
First na yenya nsuo ende na ho kire wo yeso pa.
Oni yenya nsuo kura na ye kɔ nsuo ɛwɔ ɛkire bi.
Na ye bre was one anti akwansa.
We used to first in the river. The river, now if you go there, the river is too dirty.
Na yare wo anytime bia say yes nsuo na nkwala akobra na omomo adwenso ya ne yare ahoro bebre wo nsuo.
Na nsuo ho yɛ den sɛ edu epebrima nsuo no tumi wewe ise kwachiri kakra sɛ nya nsuo anom.
Lokotwa prum ha no matna aduanan miensa ha no wo me na first na yensu ye mienu pɛ nti sensu ye ba ye koda nsu na no ewie ya donkro asna yenya ye ne de ama na etwetwe nti ye toa na akɔhyɛ kɔna bi endo ba tweno no anya hama no anya woman be sɛ fa bi no ahwe agu wa adim ansana odi abafie ndi ye da no amade kye han asna yenya nsu be sɛ 34 miensa.
We identified through an initial rapid assessment of the situation that women and girls especially were still fetching water from streams and so on. And then we realized that most pumps had broken down. So that was the main reason why we thought we should do something to ensure sustainability of the use of the processes.
We traveled far and wide to every single village where there's going to be a project to interact with the people to make sure that this project that is coming, they will well receive it and use it well.
What we are seeking to do is to provide water at less privileged communities and institutions like this one. Like this place has absolutely no water. They have some stream somewhere which is polluted. So they come up with diseases and so on. So when the need assessment was done, it was decided that we build them a borehole.
Rotary for baye nsu ma ye no aboa ye bebre anya ho faso bebre e ma ye nkɔwe nsu ni biem ye fa ya de aya konsu na no wo yakobu bi ye de abesi ye niema ye de bia ye nya adua ye de bia guare ye ma no su kosu a wokobu bi no de abe guare no de kosu.
We are na yesa ye edwuma ran yesa ye aduane ayedi na ye ton yesa aduare
opesi seya e boa ye obi aba no abesa bi akoye ne ope bia se ye ho atoyen e wo nsuo no e ben me pe nti no me ni ha kora
aboase first na yesa mansi no
nti we buy no emu say ye ho toye.
We've done 2 piped water supply systems. We have the Nkaka piped water supply system in the Memphis Central District of the Western Region, and we have a similar system at Drokochiwa in the Ayenswano District of the Eastern Region. And the Ayenswano system, I would say, is fairly bigger than this one, because that one has been projected to serve a population of about 5,000.
Wanta number 1 has been one of our babies that we like so much. Why? Because we realized that the water that we gave them was giving them a lot of problems because they keep breaking down. So we have to come in to go back to the drawing board, and what you have is as a result of us pushing them to come and give them a better option.
In this community, that's the Nkaka community, we are installing a mechanized borehole piped water supply system. The system is made up of a borehole that is mechanized, then lifted into a ground level tank that is situated on the hill. Then from the ground level tank, the water will flow by gravity to 5 standpipes that are strategically located within the community.
Ya wahana Rotary for and this is assembly by some bray issue. Inti nananom unit committee and water committee ya kan ho bom. And ya de to ma muni na anim say ehia moa. Nti enoma bia ehia say ya de free ase ho de ba soro bia no ya de kono ba. And de ba du esoro ha say. Yes yama adum pemben so ya de say.
The community, as part of our engagement, offered to construct the treatment house. I gave them the specification and they commenced work. So they've given me word that they finished the construction of the treatment house. So I'm here to inspect the house, ensure that everything is okay. Then thereafter, we bring on the supplier to come and install the treatment system.
A lot of things go into building a borehole. They check the water to ensure that the water is good enough to serve them. And so they realized that there was iron in the water. That's how come we built them a plant. So you will observe that there are places we went to where they have no iron treatment system because their water is good enough.
Sometimes we have water quality challenges with some of our groundwater sources. And it has to do with high levels of iron in the water. When we encounter such situations, we installed a plant we call the McAfee plant. It's a concrete structure with 4 chambers. And the chambers are filled with sand, media sand of varied sizes and activated charcoal. And through the process of upflow and downflow movement, the water is filtered and the communities are able to fetch clean water that doesn't contain iron.
If you take the Dunko on a few municipal hospital, initially they were relying on the regular water supply from Ghana Water. And unfortunately, there were days that they did not have water. So when we provided them with a borehole, it gives them access to water 24/7.
We don't often even use our standby Veronica buckets because there is always water from the main source.
It's just excellent. We tend to control our own supply of water within the facility now. The erratic flow, I can confidently say, is a thing of the past.
So the water helps us during the procedure of any patient.
From when the pregnant woman comes, during vaginal examination, you need water to wash your hands before you perform them. During delivery, you need water to wash your hands. After delivery, you also need water to wash your hands, and also for the mother to bath, and also to even bath the newborn babies.
Now, the clarion call for most Ghanaians is about infection prevention. No facility in Ghana can undertake whatever effective infection prevention with acute shortage of water supply. So, this intervention has really come in handy.
Now we are happy the water is flowing, and clients and relatives appreciate it, and the staffs also appreciate it. It also makes our work easier.
At Chianse, Rotary Water Facility has been helping a lot. The water system here in this community is very poor. So we have been fetching the water far away from the community. And unless we go and beg the teachers, and they will allow their students to help us in fetching water to the facility. So with this water project that has been established here, we are very grateful for what you people have done.
Before Rotary came to our aid, we were having a borehole just around, but we were finding it difficult to, pump, and sometimes it does get spoiled, and then ways and means to maintain it was a problem. We do get shortage of water, and then the nurses at times before we come to work, we have to go a long way before finding water to, the facility, which sometimes delay our work. So now that Rotary has supported us, it is helping us in a good way.
When you provide water to these communities, or sanitation for that matter, you cover health broadly in terms of improving the health of families, you improve the health of young ladies who might be going through their monthly periods, so that now they are healthy enough to go to school.
The other important aspect is that working closely with Community Water and Sanitation Agency, now all boreholes that are being prepared are actually mapped. They are identified, and that information is given to Community Water. If we just haphazardly dig holes all over, you find that one day our water tables are going to be degraded around the place, and we start having other problems.
The Rotary Club of Accra Dansoman has two project sites, one at the Techem JHS Basic School, and then there's a second one at the Methodist Inclusive School. The one at Techem has the borehole, and then a 10-seater toilet facility, that's a KVIP. And the Methodist and Special Inclusive School has a water closet for both boys and girls.
Before Rotary came to our aid, we were not having any place of defecation, no toilet around, since later part of 1960s.
My pupils had to move from this school to the public toilet outside the school because there was no school facility here.
You come to school in the morning and you open up then you see that a drawer of a teacher's table is full of feces, of human feces. And because of that, the school had a bad name.
The state in which our old facility wasn't too good before the Rotary came in to intervene. And sanitary infections such as cholera and dysentery, and even to the extent of candidiasis, was very high to especially the female teenagers in the school.
Sometimes they go at the back of people's house defecating around. Sometimes when we are being taught in the class, the people they go at the back of the house to defecate, they come here to complain.
Some are defecating around the bush at the school. You can see we have some of the bushes here.
When classes are ongoing, then you see them in the bushes. And then when it's Harmattan time, then the whole environment is smelling.
Initially, the girls, when they are in their menses, they feel reluctant to come to school because some may need to change themselves.
Some eat without washing their hands because there is no water to wash their hands. Some visit the old toilet facility and they don't wash their hands because there is nothing to wash their hands with.
It came to our notice that we need to provide the school a toilet facility and water. And it became a headache because there wasn't no fund to provide those things.
So it was around November, December, we had a privilege or fortunate to get this toilet facility from the Rotary Club Dansoman, Accra.
One afternoon in September 2016, after school, my children had left. Then one teacher from DAA brought some men to me. And they asked me, Madam, do you have toilet facilities for your children? And I said, no. Would you like to get one? And I said, I would be so happy. So there and then they said, we'll give you one. And actually, I thought it was just some joke they were cracking. The next minute, I saw that they started bringing materials, and that is the story you are seeing here.
Rotary International and USAID has provided us with KVIP toilet facilities and the hand washing facilities.
They initially provided us with the 5-seater KVIP seats for the girls and that of the boys too. And apart from that, they have also added the borehole.
Within these facilities, we also have a girls' changing room. We also have a room for those with any forms of disability. So that is catered for these two schools.
The toilet is nice. Now we defecate here. No one goes out to defecate anywhere.
We have fashion toy, we have even sink. When you finish, if you don't want to come and wash your hands outside, you can wash it inside.
So it saves a lot of time and improve our learning and teaching here.
We have a special one for the disabled one. They can use it, while those who are not disabled can also use their own.
We don't go home far from the school. We don't go to our neighbors. And the girls too, we can go to the toilet and change ourselves.
Now, students don't go to the bush to go and ease themselves for them to be bitten by snakes.
In fact, the situation now is very much improved because it's close to us. Anytime any of the teachers, if you want to visit the teacher, about 5-10 minutes, the teacher will be back to classroom. The pupils will also not walk long distance to go outside to ease themselves.
Rotary, aside the toilet and the water facility, they've also provided us with a lot of Veronica buckets and the stand, which has helped us to mount a whole lot of Veronica buckets in the school, where students come out from their class and they have it readily accessible for them to wash their hands. So they don't forget to wash their hands because the facilities are just close to them.
After the facilities were provided for these two communities, we have a high rate of enrollment. Retention has improved, especially amongst the girls, because you realize that during their menstrual cycle, they stay at home. They have issues with getting the sanitary pads and sanitary items for themselves. But now they have a changing room. They've also been provided with some sanitary items, so the girls are equally coming to school. So at the end of the academic year, you have a high rate of girls in school. Open defecation, which would generate some kind of diseases like cholera and all other diseases within the community, has minimized. Some of these facilities, even though they are in schools, are also being used by some of the communities within. So it has actually brought a lot of improvement within these two communities.
For effective operation and management of this infrastructure, we have the training and capacity building component. Under that component, for communities provided with water, we have a team we call Water and Sanitation Management Team. They are taken through training, and the training is supposed to build their capacity and prepare them and equip them with certain skills so they will be able to manage this infrastructure in a sustainable manner. As part of the training for the WSMTs, they are taken through strategies as to how they can mobilize funding. And we have a number of strategies that we introduce them to. First, we have the pay as you fetch. This is the system where you pay before you fetch water. We normally advise them to apply this method at places where we have mechanized systems. So either the mechanized or the small towns. The pay as you fetch is mandatory. But for communities where we have the boreholes fitted with hand pump, they have the option to decide to use other fund mobilization methods. And we have some few. We have the levies, that is the household levy or the individual adult levy. And these levies are collected monthly. Then also we have what we call the kilo deductions. These are done in communities where they produce cocoa. So during the harvest time, when you have harvested your cocoa and it's time to sell, when you get to the cocoa cratchy will take 1 kilo. That's your contribution towards the wash or the water fund. Then they also have special levies that they also do. So that the idea is that the community must find innovative, creative, but acceptable way of mobilizing money so that they can take care of the water facilities.
Yɛte harma sɛnea ɛbɛsɛe yɛnya nkakrakra ne yɛde ato hɔ. Ɔma akɔhu mpanyinfoɔ yɛde akɔto foturo. Ɛkyɛ sɛ sɛe a ne akɔfa bi ama abɛyɛ ne yie.
Anaasɛ ɛbɛtumi ayɛ extension koraa kɔ baabi a nsuo no bi ɛneɛ.
In schools where we have also provided facilities, we also have a team we call the school health committees. They are also taking through training so that they will also be able to manage the toilets provided them in a sustainable manner.
Since we introduced in the health club, we're doing a lot of activities with the people in the schools. So such as how to clean the environment tidy, including the facility you people have given us.
We assist the Form 1s and 2 to go there to scribe there every Friday, and the boys read around there.
I and my colleagues do a lot of things in the health club, especially when it comes to our personal hygiene and how to keep our environment clean and how to educate people so that they can keep their body clean and the environment clean.
We raised a fund and we had our refrigerator. Yes, we are selling water at the minimum price so that the children can afford. So the little that we get, we use it to support our health club. Some will come to school with the issue of sanitary pad and as we see a lot of ladies are in, so we give it to them free with the aid of that amount that we get through the selling of the water.
There's what I would say attitudinal change, behavioral change in the kids. You need not to tell a child from Buffet to Basic to wash their hands after visiting the laboratory. You don't need to do that. It is imbibing them as a result of the advocacy that you guys come and do and as a result of the program.
The project is being implemented in 7 regions in 14 districts. We have delivered 86 boreholes fitted with hand pump. And out of the 86, 13 of them have been fitted with the iron removal plant. We also have 13 mechanized borehole water supply systems. Then we have 2 small town pipe water supply systems. And one of them is the Dokrochiwa water supply systems. For sanitation, we've delivered 152 KVIPs. And for each KVIP delivered, the beneficiary schools are also provided with hand washing facilities, that's Veronica buckets. We've also delivered 8 WC, then also 4 microflash biofill toilets.
Anytime a facility is being handed over to the beneficiary, we have what we call the beneficiary education system or process. You take them through the process of using the facility. You don't assume that they know how to use it. So in going through that training, you also teach them how to maintain these facilities. As Rotarians, we are looking at sustainability. We don't want to provide the facility, then at a point in time we have to come in again. So we take them through some maintenance process on how to sustain and maintain the usage of the facilities provided.
One of the components of the project is advocacy and leadership. And under this project, we seek to partner governmental agencies and other stakeholders so that we can work together to ensure sustainability of our systems.
And so then there was need for training. Training in methods that would help at the community level. And that led us to, at a point, first we did the training on the policy advocacy, which was to first learn about the policies in existence and how we could advocate.
So we did trainings for advocates in WASH policies for them to understand the various policies that are working within the sector. We also trained them in community engagement.
In engaging the communities, there are certain tools that the advocates use. The advocates generally, during their engagements, they do what we call monitoring, coaching, and mentoring. And for monitoring, there are some tools. One is the spider web.
The spider web, for instance, has some indicators. It helps the committee people assess their own performance, and it helps them also assess the effectiveness of what they are doing. It also helps them to plan what to do.
We use a tool called scorecard, which they use in engaging the communities in assessing their roles and responsibilities. And then we also use the scorecard, community scorecard, which they use in engaging the service providers as well as the community service users. And today we also organize interface between the service providers, that's district assemblies, and then the communities.
So the communities, through the use of the scorecards, are trying to assess underwater delivery. These are the things that we should have. But currently, these are the things we have. They establish the gap. Then they move on to the next, that is the dialogue, where they engage the duty bearers to engage them on the gaps, on what should have been done that had not been done.
And minimally, for the lifetime of this project, every club had a club committee for the WASH. And these committee members, you are required to stay on the membership of the committee for the entire duration so that the people will know you and relate to you better. And they were required to pay at least 6 site visits.
We've done series of engagements at the community level. We meet with the water and sanitation teams to take them through their roles, for them to also assess themselves and then see their performance. Based on that, they plan actions to improve their performance. At the school levels, we've been meeting with the SMC, PTA, and then the school health clubs to also empower them to be responsive in terms of the roles that have been assigned to them. At the district levels, we've been meeting with the district water and sanitation team and then the top management of district assemblies, engaging them on how they can increase funding for WASH activities.
The third component of the project is innovations. And under the project, we were able to come out with one unique innovation, and that is the Football for WASH initiative. This is a play-based initiative where through play especially through the play of the game of football and football-related activities. The children are educated, are sensitized on good hygiene and sanitation behaviors.
For example, if you get penalized for something, you might say, go and wash your hands, because this is what we're trying to do here. So we use football as an innovative way of sponsoring that. We implemented this in 2 districts where we got a cluster of schools to get together.
Unfortunately, when we initiated the innovation project and interventions were picking up, we were struck with the coronavirus in the year 2020. So therefore, because of the restrictions and the closure of school, it's some way, somehow affected the smooth implementation of the innovation. They were given jerseys and other football items. We had some few football lessons, full engagement, but the other concluding parts of the interventions, coronavirus interrupted it.
The impact has been phenomenal. The populations have had improved health. It should serve as a model to Rotary International and USAID. And going forward, we think that the learnings from this project will help in delivering better water wash projects around the world.